Hi again. This short lecture segment of 3 or 4 slides is going to introduce you to the infratemporal region and the pterygopalatine fossa. So as this slide shows and mentions, this is an important area that you will need to pay attention to because we will be talking about it repeatedly. There's a lot of anatomy in this area of the skull, both muscles, blood vessels, nerves, etc. So there's a lot of activity. So let's start out getting oriented. And the temporal fossa, these are slides, or these are images taken directly out of your textbook, and I added a few of the yellow boxes to emphasize things that I wanted to discuss. So the temporal fossa is basically that portion of the skull that I'm outlining in red that's shaded in a darker color in the illustration. It's essentially the origin of the temporalis muscle, but that's the region. That's the temporal fossa. And the temporal bone and the parietal bone make that up. And then we have this infratemporal crest, and this is a landmark. It's at the bottom, and this infratemporal crest forms, it's a ridge. It's part of the sphenoid. So this bone that you're looking at here is the sphenoid bone, and then we have again the parietal and the temporal bone. But the infratemporal crest is part of the sphenoid. It forms a little ridge, and it separates the temporal fossa from the infratemporal fossa, which is below it. So the infratemporal fossa is sort of this diffuse area that I'm sort of outlining with a little green dash, more or less like this. It's just an area about, I don't know, you could put a good size cotton ball in that area. That's the infratemporal fossa. It's below the infratemporal crest. And again, the infratemporal crest is a feature of the greater wing of the sphenoid bone. So the next couple of slides are just going to drill in on this area and discuss it a little further. So an inferior view of the skull, again, the infratemporal fossa is shown more or less shaded. This is part of the sphenoid bone. So again, the infratemporal fossa is sort of this region. And it's on both sides, of course. Okay? So it's below the temporal fossa. And most of these features on these illustrations you will want to learn. So as you're going through the slides, I hope you're also looking at the book and reading the text that goes along with it. And by reading the text, it will introduce you to the language, these features, and the more that you see them, the more that you hear about them, the more that you read about them, the better you learn it. It's repetition. So the next slide, again, we're still discussing this infratemporal fossa, slightly different angle of the skull to where we can sort of peer in this infratemporal fossa, and they have outlined it again, sort of shaded it. It is more or less in this region. I won't ask you exactly where the boundaries are other than the infratemporal crest. And you need to know that's a feature of the sphenoid bone. Okay, so that's the larger infratemporal fossa. And then we have a smaller area, a couple smaller areas as you sort of zero in on this and go in a little bit further, there's another little shaded area, a little darker. And this is referred to as the pterygomaxillary fissure. So it's a fissure between the maxilla, again, this is maxilla, and the pterygoid processes. So we will talk about the pterygoid plates. They're a feature of the sphenoid bone, but these structures, they form, there's a fossa between them. Those are the pterygoid processes of the sphenoid bone. So they just sort of descend down, and all of this is part of that pterygoid process. So at any rate, the fissure is between the pterygoid process on the right and the maxilla on the left. And we wind up with sort of this red dashed line forming the pterygomaxillary fissure. And then the pterygopalatine fossa is deeper yet. You keep drilling in further and further, and then you come to this little region about the size of a pea or a large lentil, which is the pterygopalatine fossa. So it's deep in the infratemporal fossa. And there are a couple of features that I'll point out that would be good to start paying attention to, because as I mentioned in this slide, everything in here you're going to need to learn in this figure. So there's a little bit of the inferior orbital fissure. Already talked about that, and I mentioned that if you passed through that inferior orbital fissure, you would wind up in the pterygopalatine fossa. So there is a passageway to communicate back and forth between the inferior orbital fissure and this pterygopalatine fossa. So we'll be spending more time on that, so don't worry about it yet too much. Then we also have the sphenopalatine foramen. Now, imagine that you take a, a pipe cleaner or a pointer, and you come in toward the side of the skull. So we're aiming the pipe cleaner sort of straight into the screen of the computer and this image. And the pipe cleaner, I don't know if I can really draw this very well, but the pipe cleaner is coming in perpendicular. It's coming straight down over here. And it'd make a real mess out of this figure if I keep doing too much of this. But just imagine that you're passing the pipe cleaner through this area from superficial to deep. So where would the pipe cleaner pass first? Well, it would first pass through the infratemporal fossa. It would pass through that first, and then it would keep going deeper and deeper, and then it would pass through this pterygomaxillary fissure. And if you keep going deeper and deeper still, then you would pass through the pterygopalatine fossa. You'd be in that fossa. If you kept going with that pipe cleaner or the pointer through the pterygopalatine fossa, you would come to this sphenopalatine foramen. And you would pass through that. And once you pass through that sphenopalatine foramen, you would then be into the nasal cavity. Now, of course, there is going to be a nerve and an artery that pass through that sphenopalatine foramen later. So again, I'm just introducing you to these features with regard to opening and cranial nerve branches. Okay, is there another slide here? Yes. So here's a different image. This one is not out of your textbook, but it's showing basically the same thing. So again, here is the maxilla and the zygoma and the sphenoid bone and the temporal bone, just to get you oriented. So again, we're looking in this infratemporal fossa, and the box is going to be highlighted in the next slide. So deep in that box in this infratemporal fossa is the pterygopalatine fossa. So, we've already talked about that, kind of in this area. And deep in that area is the sphenopalatine foramen, which isn't shown in this illustration. Okay. So again, I would start memorizing everything in this slide also. There is the pterygoid process that I was talking about earlier. And we'll be going through that. You'll learn it quick. And the maxillary tuberosity, etc. But let's go to the next slide and finish this piece off. So the next slide is going to be an enlargement of this red box. So this is what's going to be enlarged in the next slide. And what it's going to show are different passageways that connect to this area, to the pterygopalatine fossa, because different nerves enter and leave this area. So here is that box that we just enlarged. And posterior view, anterior orientation. And here is the pterygopalatine fossa. And it's more or less like the yellow dashed line. And there are different passageways that connect to it. So there is the greater palatine canal, which allows nerves and blood vessels to pass from this fossa out onto the palate via the palatine foramen, which is a feature of the palatine bones. Don't worry about that yet. We'll get to it. And then there's also the sphenopalatine foramen that I just mentioned. Also connects to the pterygopalatine fossa. And this goes out onto the nasal cavity. So you leave the pterygopalatine fossa through the sphenopalatine foramen, and then you're into the nasal cavity. From the pterygopalatine fossa, we can also go through the IOF, and we're into the orbit. And these arrows can go either way. And then a couple other features. There is the foramen rotundum, which is an important foramen, part of the sphenoid bone. And there's a passageway through that foramen rotundum into the pterygopalatine fossa again. There is an important nerve that goes through that. And then there is also the pterygoid canal, which we won't spend a lot of time on, but it also communicates with the pterygopalatine fossa. And I believe that's the last slide for this set. And after the next section, we'll start in on the cranial bones. So make sure that you read what's on the slides. I put the little gray boxes in here for your benefit. So make sure you read that and ask questions when you have them. This is a difficult way to teach anatomy online without you being able to handle skulls. So you'll have to spend some time with the pictures and do your best with that. And there are lots of resources online, but you can learn a lot of anatomy by studying illustrations. It's the way it's been done for a very long time. So it will work, but it will take some of your study time. So we'll see you soon.